I'm Danielle Krause. I'm a third-year GYN oncology fellow at the University of Oklahoma in Oklahoma City. It is well known that obesity is linked to one of the most common types of endometrial cancer, grade 1 endometrial cancer, with the rising popularity in a lot of different weight loss drugs, in particular GLP-1 receptor agonists, more commonly known as semaglutide, Ozempic, Wegovy. It's our specific research is looking at the effect of these drugs on endometrial cancer and its precursor endometrial hyperplasia. So FWC grant specifically allows us to continue this work. A lot of our preliminary studies were in vitro studies, so looking at just the effects of this drug in cells in an in vitro model. But this grant allowed us to fund a rodent study to take it to the next step to that 3D model. So our preliminary work, which one led to the grant, but also our grant allowed us to complete and then lead to publications like in this abstract, basically showed that we are seeing GLP-1 receptors expressed on endometrial cancers, and it's increased compared to benign cells. Additionally, with advancing stages, we're seeing higher expression of GLP-1 receptors with advancing stages. So from stage 1 all the way up to stage 4. This was next followed by some in vitro work looking at just the effects of GLP-1 receptor agonist therapy on cells. And we are finding that they are getting in the way of cell proliferation, so impacting cell growth. And then the next step will be to move that to a xenograft model and seeing how the drug affects tumor growth. And those studies are currently ongoing. We should get some results in the spring in the next few months. So kind of next steps are pretty naturally to go from 2D in vitro to a rodent study and then moving on to human studies. Since these drugs are already FDA approved and commonly used in humans, a lot of people like to say like, well, why do you need to take a step back and do cell work and animal work? But whenever you're introducing a new drug, especially in the cancer arena, to be used in combination or instead of a drug that's already well studied and well established, it's important to take a step back and look at the pathways of what it works, and making sure that it's not negatively impacting drugs that we already know work so well. We are very fortunate to get a grant through the Foundation for Women's Cancer. It really did allow us to continue this really exciting work, especially with such a hot topic like Ozempic and Wegovy. And we honestly are very grateful. And I would highly encourage other people, especially in my situations, fellows doing their research here, to look for these grants, apply for these grants, because they really can make a big difference.